Good morning from Manila and welcome. Welcome to ADB's Asian Impact webinar entitled Thinking Outside the Box, Policy Recommendations for Developing Economies in the COVID-19 Era and Beyond. I am Marianne Magadia of ADB's Economic Research and Regional Cooperation Department, and it's my pleasure to be your moderator for this webinar. Due to the massive impact of the COVID-19 pandemic, the world is experiencing the worst recession since World War II. As many of you are aware, ADB has developed a comprehensive database of the crisis policy responses of ADB members, as well as the major countries of Africa, Latin America, and the Middle East. This allowed us to see how governments across the world are implementing a myriad of policy responses to the health and economic damages of this pandemic. This also showed us how the two phases of this crisis have played out in each economy. The first phase, as we all know, is the confinement or the lockdown phase. And this is where the focus really is on containing the spread of the disease and saving lives. But this entailed the shutdown of most economic activities, which led to a sharp rise in unemployment rates and an alarming number of businesses declaring bankruptcy. Which brings us to the second phase of the crisis, the economic recovery phase. This is where we are now and where governments are faced with the even bigger challenge of designing and financing huge amounts of policy support packages to normalize the people's livelihoods and the ability of businesses to operate viably. Now, this recovery is more than just a quick rebound. This is a great opportunity, actually, for developing economies to examine, to seriously look into their medium to long-term economic plans. Now, with that background, let me now introduce and proudly introduce our panelists. First, we have from Indonesia. She's a senior advisor to the Planning Minister in Bappenas, Dr. Amalia Widyasanti.
Nice to meet you, everyone. Good morning.
Yes. Joining us as well is the chairman of the Philippine Competition Commission, Dr. Arsenio Balisacan. We also have the director of the Bangladesh Institute of Development Studies, Dr. Binayak Sen.
Thank you.
We've also brought in Dr. Charles Hoyoka, professor at Kobe University.
Good morning.
And last but not the least, Dr. Scott Fulweiler, professor at University of Missouri, Kansas City.
Good morning or evening.
Now, let me share with you how this webinar will flow. Our host, the advisor in ADB's Economic Research and Regional Cooperation Department, Dr. Jesus Felipe, will lead the discussion and set the tone for this topic. This will be followed by 3 rounds of discussion by our panelists. Note that we're giving 3 minutes, just 3 minutes for each of our panelists per round to articulate and nail down their points. Then our panel discussion will be followed by questions from our audience. We will close this webinar with remarks from Dr. Felipe. Now, for our dear audience, please raise your questions in the Q&A box, and if possible, kindly make them brief and clear. We will not be able to answer, we might not be able to address all your questions given the limited time that we have. And those questions that we will be able to tackle will be posted on, and you can give a thumbs up. Those questions will be of interest to you. Now, let's delve into the topic and ask the first question to Dr. Jesus Felipe. Dr. Felipe, what exactly do we need by our call for governments to think outside the box about their economic recovery programs? Jesus?
Thank you very much, Man. Very good morning to those of you in Asia, and good evening or night to those of you in other parts of the world. It is a pleasure to host this webinar with this very thought-provoking title, Thinking Outside the Box. I believe this title is very appropriate given the severity of the situation and the imperative to get back to where we were at the end of 2019, before the pandemic. Why do we need to think outside the box? The answers to me are obvious. Let me give you three reasons. First of all, the crisis is unique in that it has four dimensions: economic, social, and even humanity has never seen anything like this before, not even the 1918 flu. Second, we're technologically much more advanced than we were in 1918, yet the pandemic has spread everywhere. With today's technical level, humanity should be able to provide technical and medical solutions to the problem, and this must be done on a record time. Third, already during the second half of 2019, there were signs that the world economy was losing steam. Coming from the 2008 and 2009 crisis, there were discussions about the role of monetary policy. The balance was tilting towards the consensus that it had run out of gas. Voices were openly being heard about the need to use fiscal policy. Now, if fiscal policy comes to the center stage this time, it will imply a significant shift in thinking with respect to how policymakers have for decades thought about the roles of monetary and fiscal policies, with the former run by central bankers being on the driving seat. With this in mind, what do I think are the key issues on our plate? Well, still many economies are unfortunately struggling within the first phase of the pandemic. They need to deal with the health problem. They need to stabilize their economy, need to restore growth, and they also need to deal with massive unemployment. On top of this, despite the need to address these short-term issues, it is important not to forget thinking for the. This is because we know, for example, that more diversified economies withstand crisis much better. The diversification of production and exports of many developing economies is a long-run process, but it needs to be a priority in the agendas. So what do I think is the $6 million question? Well, most people are worried about mounting fiscal deficits. I am much less worried, and instead, I am much more worried about the financial positions of the private. This is because policymakers will have to ensure that this sector does not run a deficit. This is a sign of fragility and a good predictor of a crisis. We know this from past crises. My personal view is that it will be very difficult for our economies to restore growth and deal with the high unemployment rates without running significant budget deficits. We know that absent a current account surplus, the only way for the private sector to run a sensible financial surplus is if the government sector runs a fiscal. This is a fact, not a model or a theory. Moreover, an understanding of the financial statements of government and private sector tells us that the government deficit directly creates a private sector surplus. Again, this is not a theory, a simple. Therefore, should policymakers fear fiscal, that I leave it up to them. What I am claiming is that unless we see a fast recovery rebound very soon, in which case, obviously, there will no need for deficits, many developing nations will be forced. Certainly, there is always the option not to run a deficit in exchange for a low GDP growth rate and a high unemployment rate, higher poverty, and greater inequality. But this is a political decision, and let's see what societies tolerate. My view is that governments have the opportunity to contribute decisively and consciously to minimizing the damage of this crisis and to exiting it as quickly as possible. I think is the difference between exiting the crisis with a broken leg or spending 3 years in the intensive care unit. This has been done already in the high income. Better run a good deficit today than being forced to run large and bad deficits tomorrow, because this will be the sign that the crisis is still with us. Now, for decades, developing countries have been told and advised to be very careful with running fiscal deficits because they seem to be the source of all illnesses. The crisis presents us with an opportunity to do better, to move forward, including abandoning this almost. Let me close by saying that ADB has been extremely proactive helping its members, and that as of early June, we had provided assistance amounting to close to $7 billion. I look forward to the panelists' discussions and their thinking outside the box. Thank you very much. Man,
Mary.
your mic is.
Pakiram nga ng ano, Gemma, ng mouse. Mel,
Man, I think your mic is on now.
sorry. Hello, everyone. Can everyone hear me now?
Yes, go ahead,
Yes.
please.
Yes,
Sorry
you are.
for that. Yes. So as I was saying, for our first round of panel discussion, our panelists will discuss the crisis from the perspective of their countries. We'll start with Dr. Fulweiler. Scott, as a member of the team that developed the ADB COVID-19 policy database, would you tell us a story of, general story of the policy responses of the governments across the world, these responses that they have announced and implemented? Scott?
Sure, thank you. Can everybody hear me?
Yes.
Yes.
We
Yeah,
hear you.
okay, thank you. Okay. Yeah, so since March, we've been developing the ADB policy database, COVID-19 policy database. We have 5 categories that we are looking at policies, policy packages that countries are putting together. Across the 5 categories that we're using are liquidity, encouraging credit creation, direct lending, equity investments, and direct income support. And across the 68 ADB members, we have packages. The packages total about $21.7 trillion, or about 30% of GDP for all of these countries together, all of these members together. And so they've gone large, and they've done it quickly. This isn't evenly distributed across the members. For the 21.7 trillion, 3.1 trillion come from the regional members, about 18.6 trillion from the non-regional members. And out of that 3.1 trillion, about 93% of that comes from 7 members: China, India, Korea, Hong Kong, Thailand, Malaysia, Indonesia, and Singapore. Also, some members, their packages are sometimes greater than $20,000 per capita. Some are in the hundreds of dollars or even less than that. And as I mentioned, about 30% of GDP, and this would break down into regional members at about 13% of GDP, and the other members at about 39% of GDP. It's actually larger than this because there's some things that are not reported, some things that are reported but they didn't provide numbers, and some things that we don't often have numbers for, like liquidity requirements and capital regulations and interest rate changes and so forth. So overall then, I would say that they've been very active. Governments and central banks have been very active compared to previous crises. They've acted on a larger scale, faster, more measures than the global financial crisis. Central bank balance sheets have increased. Government debt has increased. And interesting now, currencies of developing nations have been relatively stable. As I noted, it hasn't been evenly distributed, so we can talk about that more. I'll stop there for now.
Hello?
Yes, stop. Man, your mic is off.
You're muted, man.
With my mic. Hello?
Yes.
Right.
Yeah.
Thank you. Thank you very much, Scott. Now we go to Dr. Hayoka. Based on Japan's experience in this crisis, what are your views about transitioning from confinement to the economic recovery phase? Charles? Hello, Charles.
Charles, your mic is on mute. Please
turn it on. Sir Charles, it's on mute again. Okay, now it's on.
It's muted.
Nagahang talaga siya.
It's muted.
Professor Charles, you unmute your mic. Yeah, that's good. No, you have muted it again.
Charles, your mic is mute or mute.
Can you hear me now?
Yes.
Yes.
Okay,
Now.
good. Okay. All right. Well, I'm sorry about the technical difficulty. First, I'd like to thank Jesus and his colleagues at ADB for organizing this very timely and important event and for inviting me to be a part of this panel. Turning to the question that Man asked me, as Man mentioned in her introductory remarks, the crisis has two phases. The first phase, namely the containment phase, and the second phase, the economic recovery phase. And the point I want to emphasize the most in my remarks is that the first phase needs to be successfully implemented and successfully completed before moving on to the second phase. In other words, we initially need to give top priority to bringing the pandemic under control. How do we do that? Well, it's a little too late for this, but in the early stages, the most effective measures are, of course, testing, isolating, and contact tracing. In other words, identify those who are infected, test them, ask them who they had contact with, test those people, ask those people who they had contact with, and so forth. This is the best solution because it affects the fewest number of people and imposes the smallest cost. However, if and when the virus spreads to the community at large, these measures are no longer enough and more drastic interventions are needed, such as closing the country to incoming travelers, restricting the movement of people, forcing people to stay at home, forcing business to close down temporarily, prohibiting large-scale gatherings, etc. The problem with these measures is that although they can be very effective in controlling the pandemic, they also impose enormous economic costs on households and businesses in terms of lost income, lost jobs, and lost revenue. Many people, including the leaders of many countries, seem to feel that there is a trade-off between eradicating the virus and restarting the economy. But this is a serious misunderstanding. It's true that if strong measures are taken to control the spread of the virus, the short-run economic costs will be higher, but the long-run economic costs will be lower because the virus will be brought under control sooner. By contrast, if strong measures are not taken to control the spread of the virus, the short-run economic costs will be lower, but the long-run economic costs will be much higher because it will take much longer to bring the virus under control, and even more extreme measures will eventually be needed. So there's no trade-off in the long run. Strong measures to control the spread of the virus are at the same time, strong measures to control the spread of the virus are at the same time the best way to minimize the long-term costs of the pandemic. For this reason, I think every country and every government should give top priority to bringing the virus under control, no matter how great the short-run costs are. However, at the same time, as Jesus was emphasizing, governments should make every effort to lessen the short-run economic costs faced by households and businesses by giving them enough subsidies and loans to compensate them for their lost income, lost jobs, and lost revenues. Many countries are now trying to rush into the second phase without successfully completing the first phase, and I'm very worried about that. Thank you very much.
Right. Thank you, Dr. Charles. So now let's go to Dr. Vidyasanti. Let's hear about Indonesia. How is this crisis affecting your country, and how is this crisis particularly different from that of the 1997 Asian financial crisis as experienced by Indonesia? Winnie?
Yes. Good morning, everyone. First of all, let me thank to Dr. Jesus Felipe and his colleague to bring up this important event, and this is very timely. I agree with that. And also thank you for inviting me to participate in this panel. Turning to the questions from Anne, that COVID-19 is truly an unprecedented situation to my country, and not only to my country, to the whole of the world. And the number of cases till today in Indonesia reached 34,000 cases, which is where Indonesia now positioning at the 32nd highest cases in the world for the COVID-19. The effort to contain the virus has resulted in disruption in economic activities, as there is no other way except that we have to do social distancing and limiting interaction between people, and also we have to implement physical distancing, and as well as we have to ask people to stay at home and working from home or study from home. And while at the same time, it resulted to the contraction in the demand of the economy and creating problems in the supply side. But I agree with Professor Hiroki that this is actually for the benefit of the long term, even though in the short term that we having some cost, but for the long term, it will be very beneficial to the economy. The Indonesian economy now is slowing down to 2.97% in Q1, and it is projected to have a negative growth in Q2 because last year is actually, we have a Eid festive or Lebaran Day last year in the second quarter, and this year we really implement the strict regulation on social distancing measures, and the COVID crisis happened to our country in Q2, and then we really projected that the growth of economy in Q2 will be negative. Our inflation is moderating due to the weak of the demand, but the good thing is that the central bank has managed to stabilize the exchange rate, and of course, answering the question from Mann, how is the difference between this year crisis with the 1998 crisis? That of course 2020 crisis is very much different from the 1998 crisis. This year crisis is actually started with the health crisis, with many virus spread and anxiety of the people, and this situation has created uncertainties to the economy and giving pressures to the demand and supply side of the economy. Therefore, the real sectors were under pressure because of health crisis. And furthermore, due to the real sector pressure, and the credit risk is increasing and creating further problem to financial sectors. And again, the scope of the crisis is also happened to all countries in the world. Difference from the 1998 crisis, the 1998 crisis started with the currency crisis in Thailand and spread limited only to ASEAN countries. And the crisis started with the currency crisis and creating uncertainties in financial sectors. And again, this is only the economic crisis.
With Yasanti, fascinating. We'd like to hear more about this, but unfortunately, we'll have to move on.
Okay.
Let's try to go back to your point on that. We have to move on now to Dr. Sen. What are the challenges facing South Asian countries, particularly Bangladesh, in dealing with this crisis? Binaya, please.
Yes, I think the cumulative underinvestment in public health over the years has magnified the effects of the present crisis. It is reflected in very low allocations, public allocations for public health. Bangladesh is the lowest in terms of public health expenditure GDP among the South Asian countries or low-income developing countries, at less than 0.7% of GDP. India is no better in this respect at 0.8% of GDP. Pakistan is 0.7%. Sri Lanka is much better at more than 2% of GDP, which was our target in the 7th five-year plan. Second challenge was that not only the allocation was limited, but the health sector governance was a serious problem, and it is still there. Third problem that I want to highlight is that there is a large concentration of new poor around the poverty line. So if you calibrate the poverty line just by 10%, you will have 20% new poor in 2010. And that ratio has increased to 28% in 2016. So pre-existing vulnerabilities in terms of new poverty is a serious problem. And then we have problem also in the thinking outside the box, as you rightly captioned today's talk. For better or worse, we have been guided by the TTQ model. That is the model that emphasizes the testing, tracing, and quarantine. And that quarantine model came in Europe in 14th century when the plague broken out in many countries. And that model didn't work when in 1830s Europe faced cholera epidemics, because that required not just quarantine but improvement in the living condition of workers, health and safety condition of workers, and that led to the investment, public investment in health sector. Particularly, you may recall that in Victorian England, there has been a massive investment in underground sewerage system in London. So Michel Foucault, one of the philosophers whom I cite frequently, says that there was a shift from quarantine model-based disciplinary power to working condition improvement-based biopower. But that shift didn't take place in the context of developing countries, particularly low-income countries like Bangladesh. We are still stuck in the disciplinary power model. We are saying everybody to remain in the domesticity, confinement of our homes, and try to do all these hygienic practices, wear masks in the outside. But that is not enough to cope with the present crisis.
Yes, Dr. Sen, very good points. We're hearing you. We'll have to move on now to Dr. Balisacan. RC, on the Philippines, please tell us, what is the current economic condition in the Philippines and the policy constraints confronting the country? RC?
Thank you. Okay, to provide context to the question, let me note quickly that the Philippine economy entered the 2020 with strong growth prospects. The economy was among the fastest growing emerging economies in Asia and was expected to join the ranks of upper middle income countries in 2020. Its macroeconomic fundamentals were pretty strong. Steady declining debt to GDP ratio, relatively low fiscal deficit, and stable inflation, high gross international reserves. We had credit rating upgrades in recent years, low rates, lowest rate and unemployment in the last 10 years. Poverty reduction was responding strongly to rapid growth. In recent years. Now, a series of unforeseen events put an abstract momentum out in the early this was the pandemic, the situation of March. Now, the pandemic was protect lives to contain the coronavirus and to ensure that the health system be overflowed. The government says lockdown, having a wide swath of The lockdown was pretty effective in taking the coronavirus and causal countries. And while the lockdown is recently gradually opening up the economy, starting with sectors producing essential goods and services, people's mobility is still restricted, particularly the strict controls on public transport and health. Also, the continuous stress owing to low consumer confidence and disruption in life. But of course, the cost and the social sector have been very high. GDP sharply contracting by 1% year, quarter of 2020. Its first over 2 decades. Unemployment is its highest level in 2 years, and unemployment not captured by the force. Those returned contract work, tens of thousands of them. The government has responded quickly to the crisis, mobilizing military and schools to provide emergency and vulnerable as well as resources COVID-19. The revenues expected to fall short. Budget debt is expected to rise 8.5% this year to 8.5% in 2020. Highest deficit that we would have in 50 years. Debt to GDP ratio is expected to rise again from 4% in 2019 to around 3%. Now, of course, this impact has been worse, I believe, the conditions of macro
Dr. Balisape, RC, sorry, there's a lot of echo in your from your side. Later we can get back to that your point on that. But right now, let's move on to the next round of discussion. The next round, we will talk about policy recommendations out of the box and bold ideas for countries to recover and come out stronger from the crisis. So this time we will start with Yasani. We need what are the term policy options for Indonesia and how would sound fiscal monetary coordination mitigate economic Winnie?
Yes, ma'am. Thank you very much for the question. To reduce the negative impact of COVID-19 crisis to the economy in the short term, then the role of coordination between monetary and fiscal policy is very important. And Indonesia is now really aware of it. In April 2020, Indonesia stipulated a law mentioning that the fiscal deficit can be relaxed above -3% of GDP, meaning that this really gives a room to the fiscal authority and the government of Indonesia to do fiscal stimulus during the crisis. And to do the counter-cyclical policy to this one. Sorry, can you see my video?
We can put you on the live feed. Maybe there's a problem with your internet, but please keep talking. Thank you.
Sure. On the other side, the government revenue during the situation is decreasing due to slowing economic activities. However, the government of Indonesia is committed now to have a fiscal expansion, especially to finance effort for virus containment and for doing the economic recovery and social protection during the COVID-19 crisis. Furthermore, under that law, the Central Bank of Indonesia, as the monetary policy authority, is allowed now to buy government bond in the primary market. And the Bank of Indonesia is now standing ready to be the lenders of the last resort weekly when the market cannot absorb the targeted government bond issuance. And the monetary policy is stimulating the economy by reduction in policy rate and reduction in minimum reserve ratio, and other measures to stimulate the economy on the fiscal side is by providing tax relief for the affected business, and a further reduction of 3% will also be applied for any domestic taxpayers that meet some criteria. As well as the government of Indonesia is also providing extension of tax filing deadlines. I'll stop here, man, and we can have a further discussion on this.
Thank you, Winnie. So back to Dr. Sen. According to our database, Dr. Sen, Bangladesh stimulus have reached $11.3 billion. Where only about 4% is for direct income support. Could you give us the sum of government responses and elaborate the urgency of livelihood protection and measures towards immediate economic recovery? Dr. Sen.
Sorry, man, I was temporarily cut off, so I don't know whether you have addressed me or not.
Yes, it's you, Dr. Sen. You want me to repeat the question, or you got it, sir?
Yes, please.
Yes. I was asking Dr. Sen that we have in our data that Bangladesh stimulus have reached $11.3 billion, and only about 4% is for direct income support. Could you tell us or give us a summary of the government's key responses and elaborate on the urgency of livelihood protection and measures towards immediate economic recovery? Dr. Sen?
Okay, thank you very much. The 3.9% of the total stimulus package for direct income support is clearly inadequate for meeting the need of the already existing extreme poor and for meeting the need of the new poor. According to my estimate, under different scenarios, due to lockdown, from 8 million to around 25 million new poor would be created if complete lockdown continues. The second point is that there is the transfer amount is extremely modest. It is 500 to 700 taka per month per beneficiary, whereas agricultural wage rate is 500 to 700 taka. So you can see how modest is the transfer amount. Third is that there is a strong leakages. Around 50% of the social protection schemes currently operated in Bangladesh are leaked out to the top 50% in rural areas. So the suggestion is that the Bangladesh should go for digitization and linking, like India, good register of new and existing social protection beneficiaries in the Aadhaar card, and that will at least try to minimize the leakages. Second is that we have to encourage more participatory governance, more decentralized governance, because it is very difficult to maintain the proper targeting only from the center. And we have to recognize village as the primary economic unit. So in order to avoid further leakages. Public expenditure in this budget this time, because the budget which is being proposed in Bangladesh is business as usual. It is focusing on economic growth acceleration and less so on public health expenditure. Surprisingly, there is not much revamping public health sector. I just want to testing costs around the base garments industry worker is 8,000 taka per month. So how can a RMG worker can do her PCR testing in a private lab, spending 50% of her? So there is this question of increased subsidization, even with respect to the COVID care. We need to prioritize more social infrastructure and less of mega projects like Rupur power plant or some mega highways for this year. We are not opposed to having those mega physical infrastructure. But I think in a COVID year, if we cannot change or reorient the public expenditure system, we cannot make radical reform in the public health sector that is necessary. We must have universal health for everybody.
Dr. Sen, yes.
Must have broad-based social protection.
Thank you, Dr. Sen. That was, yes, we heard you on that. Let's now go to back to Charles. Charles, according to our package, Japan's package is currently the second largest in the world, about $2 trillion. Could you give us some highlights of Japan's response to the crisis, please?
Okay, sure. Can everyone hear me?
Yeah.
Okay.
Yes.
Yes, you're quite right that Japan's stimulus package is really huge. As we can see from the ADB COVID-19 policy database. First of all, I just first wanted to put in a plug for this database, which Jesus, Scott, and the entire ADB team has been putting together. This database will prove to be very invaluable as countries try to figure out what policies to implement in response to the pandemic. And the ADB should be congratulated for having the wisdom and the foresight to compile such a useful database. But getting back to the case of Japan, if we look at how things turned out in Japan, we would have to say that Japan did something right. The number of confirmed cases of COVID-19 and the number of deaths due to COVID-19 in Japan are both only about 1% of the US level. So Japan has done 2 orders of magnitude better than the US and better than most other countries also. In terms of GDP growth, both the IMF and the ADB predict that in 2020, GDP growth in Japan will be considerably higher. In other words, much less negative than in other developed countries and also than in the world as a whole. So it looks like Japan has done very well compared to other countries. And the reason is that the policy measures taken by the Japanese government have been sensible in general, although they were, of course, not perfect. During the containment phase, Japan was very diligent about testing, isolating, and contact tracing. And when community transmission started increasing, the government declared a state of emergency, closed down schools, asked people to stay home, asked non-essential businesses to shut down temporarily, etc. And thanks to these measures, the virus was largely controlled by the end of May, and most restrictions were eliminated or relaxed in early June. As for economic measures, Japan enacted 2 very large supplementary budgets in April and May and gave generous assistance to both households and businesses that were adversely affected by the pandemic or by measures designed to control the pandemic. For example, every man, woman, and child in Japan received or will receive 100,000 yen, almost $1,000 US. In addition, adversely affected businesses will receive subsidies and low interest loans. Employers will receive employment adjustment subsidies, so they won't have to lay off workers. College students in financial need will receive subsidies and so on. So there have been a variety of different fiscal measures to help the people adversely affected. So in short, Japan has implemented appropriate containment measures as well as appropriate economic measures. And as a result, the virus has been largely contained without a collapse of economic activity. Thank you.
Yes, excellent, Charles. Now let's go back to the Philippines. Dr. Balisacan, according to our database, the Philippines package has now reached $20 billion. Please tell us the expected death of the recession and impact on poverty and equality that this package hopes to address and the government's major economic efforts underway. If you could also do a short summary of what you were trying to tell us earlier. RC, please.
Okay, thank you. One thing for sure is that the economy will contract this year. Estimates vary widely, but 3 to 5% is in the order of high likelihood, not even discounting 7% if there's a second wave of lockdown. The lockdown has sharply increased unemployment rates, as I mentioned earlier, and the estimates does not take into account the fact that millions of workers have voluntarily withdrew from the labor force for fear of infection or lockdown, as well as tens of thousands of returning OCWs. We expect to see a sharp increase in poverty, possibly wiping out the gains in poverty reduction in the early or second half of the past decade. For example, in an ongoing work, we are finding that the current government's relief assistance to the poor and vulnerable groups has helped. But even if you assume perfect targeting of the income transfers, this would not be enough to prevent poverty from surpassing the level reached in 2015. The pandemic and the lockdown also exposed a weak fiber in Philippine society, that is the high economic inequality. And this inequality means that those who have less in life have even less of the essential goods and services, particularly health, transport, and food during pandemic and the economic crisis. If left unaddressed, this rise in inequity during this crisis, can stifle human development and hence the prospects for shared growth and prosperity. The numbers we are seeing in the ADB database as to the support for the COVID measures for the Philippines are high, in the order of 5.4% of GDP. But this does not even include the many proposals that are still coming in the pipelines, both in the executive branch and in the legislative branch. For example, there are two bills that just passed the House, the lower house, the House of Representatives. It's if enacted would mean about 50% of GDP additional resources that would come in. Congress has also the Senate is also deliberating another bill which amounts to $2.8 billion, or roughly 0.7% of GDP. So there's enormous resources that are being proposed to address the COVID problem. But what I would want to pose here is that perhaps it's not so, the size of the recovery or stimulus program matters, but what matters even more is the quality of the stimulus program. And here, really, the focus should be on supportive or facilitative policies that save jobs and livelihoods, especially the medium and small, including even micro enterprises, provide safety nets to the poor and the vulnerable groups, and even more importantly, build strong foundations for an inclusive and resilient economy. For that matter, I would argue that we should have a very strong supportive policies on public investment in health systems and digital infrastructure, and even a robust enforcement of competition policy during recovery.
Thank you, RC. Pleased to hear about the bigger packages coming out for the Filipinos. So let's go now to Dr. Fulwiler. Scott, give us an essential advice to policymakers to get out of the crisis with the least damage to the economy. Scott, please.
Thank you. So I'm going to, I think what we need to do is define what would get us out of the crisis the quickest, which would seem to be that the private sector's financial positions be brought up to being at least as good as they were when the crisis started. That would be the quickest way to get moving again, as we were doing pre-crisis. So this is going to mean, and Jesus referred to this a bit in his introductory remarks, so I'll be brief on that. But this is going to mean, absent a significant current account surplus, which becomes more precarious as we go, given the state of the global economy, it's going to mean fiscal policy to a significant degree, not exclusively, but significantly. So, and again, as Jesus said, running good deficits now to get moving rather than the bad deficits later that are much bigger because the economy has slowed down and revenues have collapsed and so forth. Of course, the questions will come up about how is this paid for, as always. And again, Jesus alluded to some of that in his comments. But one of the things we've seen already in the last few months is more than 20 central banks are engaged in direct or primary market, secondary market purchases of government debt and direct lending. And so we need to understand that when this happens, it's not like the usual stories we've heard where households and businesses borrow and it's not the same thing, or when the central bank gets involved, it's just automatically inflationary. So it was fascinating to hear about the interdependence between fiscal and monetary policy that we're seeing in Indonesia. It's not widely recognized that government debt auctions settle on the central bank's balance sheets. And so the government doesn't need the central bank's reserves. That's already the central bank's liability. So just in the last few seconds here, I think I invite everyone to take on an exercise in rethinking. What if instead of the government running the deficits, the central bank made loans and then canceled the loans, made loans to the private sector and then canceled them? Where's the deficit? Where's the debt when that happens? It's the exact same effect to the private sector's financial positions, but we think about it differently. What are the rating agencies? How are they going to downgrade you if it's the central bank's debt and not the government's? Okay, I will end there.
Scott, we're getting excited on that, So for a final round of panel discussion, it will be on the same vein of out-of-the-box policy recommendations. This time, let's start with Winnie, Dr. Widjasanti. In 2018, the government of Indonesia and ADB collaborated on a project that underscored the need to industrialize to achieve higher growth levels. In your view, does Indonesia need to rethink its economic transformation strategy, considering the new realities forced by this crisis? Winnie, please.
Yeah, thank you, Man. The 2018 collaboration between the government of Indonesia and ADB on industrialization was really an exciting exercise and recommendation. And then it is a very excellent studies that we really refer to that study when we are preparing the medium-term planning document for 2020-2024. And now Indonesia is currently do some adjustment in doing the country's transformation because COVID-19 crisis is actually really a good lesson learned to all of us. We realize that the health facilities and surveillance is actually very, very important, especially when we have to solve the problems of the health crisis. Therefore, in 2021, our development planning strategy, we are doing some adjustment to respond to the COVID-19 crisis. Because we know that the 2021 is really matters to Indonesia and also the basis for Indonesian development to the future. So in 2021 development planning document, we do some adjustment to the theme of Indonesian development to really highlight the economic recovery and social reform. And the effort for 2021 development activities will be focused on 4 aspects. The first one is recovery of industry, investment, and tourism, as well as food security. That is for the economic recovery. And the second one, that we are going to do social system reform, because social protection really matters a lot after the COVID-19 crisis. The third, a very good lesson from the COVID-19 crisis is that Indonesia has to do the health system reform. And the fourth one, that we are going to focus also on the disaster resilience for non-natural disaster, because actually Indonesia really well prepared for the natural disaster such as earthquake, tsunami, and also, for example, what do you call it? The eruption. The eruption. But actually, we are not ready yet for the disaster resilience for non-natural disaster. So to end up my talk here, that Indonesia still want to undertake the economic reform, because economic reform is really matters for the long-term economic growth and also to increase the potential growth. But we also note that we need to do it. We need to do the economic reform with some adjustment. For example, that what we learned from COVID-19 crisis, that digital technology has to be adopted sooner than we expected. And also priority sectors of manufacture also need to do some adjustment. For example, that the pharmacy and chemical industries could be one of our top priority, given the fact that Indonesian people now is really demanding for the health issues and also medicine, and also for health, for their well-being. So yes. I think some priorities need to be adjusted, but the thing is that we still need to have to undertake economic reform for our sustained economic growth. Thank you.
Right. Thank you, Winnie. Let's go back now to Dr. Sen. Is this crisis leading to an increase in poverty and income inequality in Bangladesh? And how is the labor market behaving? And what are the medium-term health and social protection measures that are crucial to achieve a sustainable economic recovery? Dr. Sen, please. Dr. Sen? Hello. Okay. Hello, Dr. Sen.
Yeah.
Dr. Sen, I'm sorry, you seem to have. Hello. Dr. Sen, we can't hear you. Can we go back to you? Probably go back to you when your internet connection gets better, Dr. Sen.
Estimated that from 8 million to 25 million new poor, and yes.
Dr. Sen, we can't hear you.
Can you hear me?
It's not very clear. Can we go back to you later when you have your internet connection better? Okay. Yeah, right. Let's move now to Dr. Balisacan. Share with us why competition policy is crucial in the government's design and rollout of economic stimulus programs. RC, please.
Thank you. Well, let me start by pointing out that the economy's ability to grow in the medium to long term will be either aided or constrained by the policy choices made during the crisis. So policies must be carefully crafted so as not to stifle long-term prospects for innovation, growth, and consumer welfare. Competition policy is a critical complementary strategic lever for a recovering economy like the Philippines. By competition policy, we mean making markets work better to advance consumer welfare and inclusive development. A recovery anchored on competitive processes will build a robust foundation for sustained and inclusive growth. Globally, the Philippines fares relatively poorly in cross-country comparisons of domestic market restrictions and market concentration. But there's enough evidence in the literature that suggesting that high market restrictions and high market concentration stifle prospects for sustained growth and inclusive development. Relative to other countries in Asia, East Asia, and the Pacific region, the Philippines harbors a higher proportion of monopolies, oligopolies, and oligopolies in the manufacturing sector. And there are World Bank research also indicates that the Philippine markets exhibit higher restrictions on competition, and restrictive state measures significantly contribute to this outcome. Now, if, as I said, if you are not careful, you might emerge from the crisis even more restrictive than the state where we come from. And so competition policy has to be a part of the lens. So to avoid or mitigate the impact of short-term and medium-term implications of the COVID-19 crisis on market conduct and market structure, it's crucial to apply competition lens to government policy decisions. Almost all of the COVID-19 policy measures, name it, subsidies, bailouts, nationalizations, price controls, cooperation of competitors, and mergers, come with the associated risk of distorting the playing field for businesses. This risk can be mitigated, however, through pro-competitive solutions. For example, subsidies, if not carefully crafted, can be both ad hoc and selective, thereby distorting the playing field of businesses within and among different industries. To avoid these consequences or this consequence, the state aids need to be based on objective criteria, clear and transparent rules, and applicable to all businesses within an industry, not skewed toward select favored businesses. Furthermore, support measures should be time-bound to reduce the risk of rent-seeking behavior and to ensure that undistorted market dynamics will produce competitive outcomes in the long run.
Thank you. RC, can we go back now to Dr. Sen? You have
Yes.
your question, right? So please proceed then.
Yeah. Okay. So basically, I'm saying that the greatest challenge is this in this year to have a political consensus to reform the public health system in the country, because the current budget seems to be still focused on economic growth and growth acceleration. It is still stuck in the growth discourse. But in an agrarian country, agriculture is more or less freely operating, and so we have kind of a basis for generating food security from inside the country. We need not worry on that front. What I worry about is that even in this COVID year, we could not allocate required resources at least to 1 to 1.5% of GDP for public health. We could not have a strong and permanent regulatory commission to minimize the governance risk in health spending. We could not encourage a complete register of social protection beneficiaries for the existing poor and for the new poor. So even if we declare certain incentives and transfer benefits for them, we cannot disburse them effectively. Hard lockdown in order to remove the threat of virus is not feasible in countries such as Bangladesh. It may be feasible in Japan, where the population density factor and the capability factor is much higher, but it's not possible in Bangladesh. On the other hand, the soft lockdown without any health concerns is also not feasible. We have to strike a balance between the health concerns and the economic growth recovery concerns. And to that end, we need to invest in primary first line health infrastructure, both at workplaces and in the places of residence, especially in red zone areas, especially in urban areas, because in rural areas there is some semblance of primary health infrastructure in terms of basic vaccination of children and women. But in urban poor settlements, low-income settlements, absolutely there is no presence of health infrastructure. We need to develop that. We need to develop some kind of micro health insurance for the workers engaged in the export-oriented sector. And we need to stop lying about COVID statistics. We do not have transparent statistics of how many COVID beds are available, how many ICU units are operational, how many are really getting infected, and what is the death rate. I give just one example. If you compare the total infection rate from the Worldometer's data, you will see in Bangladesh, in May first half, there were 20,000 infections. Now we have 70,000 plus infections. But even in May first half, we had case fatality rate to the tune of 1.36%. And even in June, we have the case fatality rate of 1.36%. How is it possible that infection rate has more than 3 times increased, but our case fatality rate remains stable? So we suspect that many of the poor, particularly asymptomatic poor, are not being tested. And they are not willing to test themselves because of the cost involved. So all this requires subsidization. It's very difficult in a crisis year to fund all these subsidies from the fiscal envelope. And hence, there is no option other than borrowing from the banking system. And my view is that in this COVID year, we may allow ourselves to run into a higher deficit from the prevailing 4-5% of fiscal deficit to 8-9% of fiscal deficit. That's all right, because once the COVID crisis is being tackled, economic recovery is visible, the fiscal deficit will come down. Thank you.
Yes. Thank you, Dr. Sen. Let's go now to Charles. Charles, what are the lessons for Asian countries that we can learn from Japan's experience in this crisis? Charles?
Okay, thank you, Man. I think the basic causes and solutions of the pandemic are the same in every country. And since Japan has been so successful in dealing with the pandemic, both with respect to the containment measures as well as with respect to economic measures, I think there are a lot of lessons that other countries, including countries in Asia, can learn from the Japanese experience with respect to both types of measures. And as I've tried to argue, the key lesson to be learned from Japan is that strong measures need to be taken to contain the virus, and strong measures also need to be taken to help the adversely affected households and businesses. However, there are, of course, important differences between developed countries and developing countries, between Japan and other countries that need to be taken into account. For example, the proportion of people who live hand to mouth, who have very little savings in the bank, who will not be able to buy something to eat if they can't work for just 1 or 2 days, is much greater in developing countries than in developed countries. So it's therefore much more urgent to provide assistance to such people and to provide the assistance quickly in the case of developing countries. Another difference between developed countries and developing countries is that developing countries typically have much less fiscal space or policy space to provide assistance to households and businesses that need it than developed countries. And if the government of a country doesn't have enough fiscal space or policy space to provide adequate assistance to adversely affected households and businesses, other countries and international organizations such as the ADB need to step in to help the country to provide adequate assistance to the affected parties. As Jesus already described, the ADB is already doing this in many countries, and it should be commended for its efforts in this area and should be encouraged to continue and further expand such efforts.
Sorry, Charles.
Okay.
We're sorry to cut you, but we're like left with 5 minutes. So, Dr. Felipe, may I ask you to decide, should we ask Scott for his final thoughts, or do we take questions?
I think so. Scott, very quickly, some final thoughts, and then let's see whether we have time for maybe one question or two questions.
Thank you. Scott, your final thoughts.
Okay, thank you. So, of course, we never want to waste a good crisis. I would suggest there are two core points here. As was just alluded to, maximizing or increasing policy space, and returning to a growth strategy. In the overall goal of increasing resilience and empowering, I would just say, I guess, empowerment. So in terms of more policy space, I would define this as the ability to pursue the policy, your own macroeconomic policy, without reversing it when international markets begin to depreciate your currency, or the ability to counter that without reversing your policy. So again, we go back to financial positions of the private sector. As we're seeing in this crisis, what you allow, you will take on in the next crisis onto your balance sheet. Again, central banks and governments are taking on somewhere in the neighborhood of 30% of GDP. Utilize the fact that you have a domestic currency and can directly support incomes, and that in that case you also have the ability to have the interest for the government's refinance and financing of its debt as a monetary policy variable. Recognize that the central bank's funding of government right now is about putting rates at the target path in illiquid markets and in liquid markets where the expectations of the path of monetary policy hasn't been enough right now. And recognize in normal times that this sort of support is already indirect, implicit, but it's still there. So I don't have time to go through all the details, but we need a policy framework for fiscal and monetary policy interdependence. Recognizing fiscal policy, fiscal stimulus increases spending out of more income. Monetary policy is going to increase spending out of the same income, reducing interest rates to get people to borrow and such. It doesn't mean you don't use it, but it means you have to recognize they have differing effects on financial positions. And if financial positions are important of the private sector, we have to recognize that we have tools that have differing effects on that. There are obviously balance of payment constraints to varying degrees. We can talk about that. I see I'm running out of time here.
Yes.
And we've already heard about growth from a few other speakers, so I will leave that one.
Yes. So, Dr. Felipe, our host, do we still take a few questions, or would you like to close now our webinar?
I think it's very unfortunate. I'm receiving very pressing messages from the producers asking us to keep the time. We have very interesting questions, but it's very unfortunate that we have these problems with the internet and does not allow us to take it. So very, very quickly, I will just make 2 points or 3 points out of what I have heard. One is that the Asian governments have been tremendously active in their interventions since the beginning of the crisis. In the region, about $3 trillion have already been spent. Extremely large packages never seen before. Active governments, fast, very creative measures. Central banks' balance sheets have increased. Still is the dilemma of, at least in the minds of some, government intervention seen as controversial. As I pointed out at the beginning, it is simply a political decision. What is very interesting is that I heard all speakers talking about Bangladesh, Indonesia, the Philippines in particular, at the end of the day, they're really talking about somebody needs to do certain things. That somebody is only the same agent in the economy, which is the government. Very low health spending in Bangladesh, inequality, poverty increasing, etc., etc. There is plenty of room for coordination of fiscal and monetary policies, and we are seeing very clearly in the cases of the Philippines and Indonesia. Winnie and Dr. Sen have called for sensible reforms. This is a great opportunity. This includes making sure that the crisis does not result in more concentration, as Dr. Balisakan was pointing out. I will just close with saying that ADB has been extremely proactive until now, and it will continue providing assistance to the members as this is needed. Thank you so much, man.
Yes, thank you everyone for joining us and for your patience that you've stayed with us given all these glitches. But we hope that you found this productive and useful. We've received emails from the NEDA, for example, of the Philippines, that they want to join to have some ideas about the drafting of their next economic plans. Now, for our next Asian Impact webinar, it's going to be on the lockdown, loosening, and Asia's growth prospects. And our host for that webinar is Director Abdul Abiad of the Macroeconomics Research Department Macroeconomics Research Division in ERCD. So thank you, everyone, and that's it. Stay safe, guys. Stay safe. Thank you.